Hi, I'm Dr. Shruthi, anesthetist at Apollo Cradle, Brookfield branch. So today I think the most happening thing in any maternity setup is talking about painless deliveries. So me being an anesthetist, definitely I would suggest everybody, every first time mothers to go for epidural. The most important advantage with an epidural is, first thing is definitely when you're in labor for 10-12 hours, so that is an average any first time mother will be in labor for 10-12 hours. So when you're in labor, when you have an epidural available, we don't let you be in pain for 10-12 hours. So when you take an epidural, I would guarantee, or anybody can guarantee, at least 90-95% pain relief. So once you're out of pain, you will definitely enjoy your process of labor, and then it actually increases your chance of normal delivery. So see, sometimes when you don't take your epidural and you're going through very bad pain, there are many chances that most of the mothers give up and they ask for C-sections. So that is the reason we say epidural actually reduces your chances of C-section. It increases your chances of having a normal delivery, and it definitely gives you pain relief. So at least around 90-95%. And the second important advantage with an epidural is it gives you time to wait for normal delivery. So see, sometimes if you're taking a little bit longer time for a normal delivery to happen, and it actually pushes you not to go for a C-section immediately. So it gives you time to wait until things normalize. And then the next advantage is, as you're relieved of pain, you will be comfortable. So in the last minute when you have to push your baby out, so definitely when you're not tired enough, you will have the strength to push your baby, okay? And there are no as such any side effects with epidural. It is much safer than a spinal anesthesia, I would say. But sometimes, probably in 2-3% of the cases, it can cause fetal distress. But usually it doesn't. We don't let that happen, because we give you oxygen and then we hydrate you properly. So as such, we don't see all that happening, but I would say only 1-2% risk post epidural. And then as such, no future side effects with epidural. People do say it can cause backache, because the moment I start counseling my patients for epidural, the first question pops up is, does it give us future backache? There are no studies that epidural or either spinals has given backache in future. As such, literature says it is only less than 0.5%, so which you can imagine it is very much negligible. In case if you land up in a backache, it could be just because of your mechanical stress post having a baby. And then if you ask me how the epidural is given, see, it will be like, first thing is, when you're like 2 centimeters opened up in labor, so you know the process which you have to open up at least 10 centimeters for the baby to come out. So once you're like 2 centimeters, the gynecologist will tell you the need for epidural, and if you're okay with epidural, then I would come in. I would still counsel you about epidural. I'll explain you how it's given, everything. Only once your consent is given, we'll go ahead with epidural. So if you want to know about how epidural is given, it will be like a very small prick or very small injection on your back. And then post epidural, you can expect pain relief in 5 to 8 minutes, hardly, or less than 6 minutes. And then from then on, you'll have continuous pain relief till you deliver, or whatever is the earliest. So, and then we monitor your baby closely after epidural is given, so that there's no stress happening to your baby. And then once the epidural is given, we don't let you walk around till you deliver, because little bit of numbness is expected in your legs. So that is the reason, because of safety issues, we don't let you walk around. But otherwise, please go for epidural. It is very much safe. 99.99% it is safe, and we do consider giving epidurals for all first time mothers who's willing for normal deliveries. And it definitely, as I said, it definitely increases your chance of normal deliveries. So try for it.